Time is 10. So the time is now 10 o'clock, and I would like to call the CCS Budget and Finance Committee meeting to order. Beth, can we have a roll call, please?
Anthony,
Here?
Erica,
Here.
Jim,
Yes.
Melissa, Ishwar,
Yes.
Tim, it's running late, and Alex.
Here.
Am I
For
not on the
CCS,
committee anymore?
we do have Rebecca, Deborah, and Beth for CCS.
Great, thank you. Are there any additions to the agenda?
I don't think my name was called, and
Did I miss you, Mick?
I don't know. Maybe I'm not
I
on the
went
committee
right
anymore.
over
That's
you.
fine.
I'm sorry. No, thank you. I made that note.
All right, besides making sure that we've got Mick here, is there anything else we want to add to the agenda? All right, hearing none, is there any public comment? Seeing none, let's move on to the review and approval of our minutes from November 17th, 2025. Are there any additions or corrections to those minutes? Hearing none, is there a motion to approve those minutes?
So moved, Ishwar.
And this is Anthony, and I will second.
Okay. Ready for roll?
Yes.
Anthony,
Yes.
Erica,
Yes.
Jim,
Yes.
Melissa, Mick,
Yes.
Ishwar,
Yes.
Tim, and Alex.
Yes.
Thank you.
Great, we have minutes. Okay, the next item on our agenda is the discussion of the Wintrust Bank document that is in our packet. Rebecca,
yes.
would you like to tell us about that?
I would love to. Beth put together this document. Thank you, Beth. We received a notice from Wintrust, just like a generic notice that fees would be increasing. So Beth set up an appointment with Treasury Management to review our accounts and pricing and see what we could do to avoid the impact of increasing fees. And they put together a proposal that includes, right now we're on a business analysis account, and they're proposing that we move to the Elite Checking account, which is like a small business account, and add automated sweeps and zero balance services. I am happy to go through the implications of this. Before I do, are you familiar with the zero balance and sweeps, or is this new? This was new for me. Is this new for others?
I'm a Wintrust client and I'm not familiar with this service.
Okay, so let me I think I was just looking at the spreadsheet again, and I think Beth's document is as good or better than the spreadsheet. So, or the PowerPoint they provided. So, so Beth put together this document. Kind of the first component is moving from this business analysis account to the Elite Checking, and that would reduce our fees from about 150-ish a month to $82 a month. So that in itself would be a good move. But kind of the most compelling component of their proposal is the combination of this automated sweep and zero balance account services. So right now we have 3 accounts, and the proposal would have us keep these 3 accounts. Our current process is that every month Beth looks at our checklist and looks at our account balances and manually initiates a transfer to make sure that we have adequate funds in our operating account and our payroll account to pay our monthly bills, and that we have a cushion, and that everything else is in the money market account to be generating interest income. The automated sweep process would set the operating account to always have a balance of $75,000. And so every day, anything over $75,000 in the operating account would be automatically transferred by the sweeps process to the money market account at the end of business. And if the operating account is below 75,000, funds would be pulled from the money market into the operating account. So what this means is, for example, we would always have the maximum amount in our money market account earning interest, and everything would be automated, removing the opportunity for user error and like reducing staff overhead between Beth and myself managing the transfers. Beth and I had a lot of questions about like, wait, what? How does the money work and getting paid and the bills? So essentially when the checklist is posted or when a check is cashed or an ACH is pulled from the account, for a period of hours, there would potentially, if the amount was over $75,000, there would be a negative balance in the operating account. But our total available balance, including the money market, would be plenty to cover it. And then at the end of business, the accounts would automatically be aligned and updated. So the appropriate amount would be transferred automatically from money market to operating. And so all of our transactions would be covered. Similarly, the payroll account, instead of having that set balance, would be at a zero balance. So the payroll account would just sit at zero. Beth would process payroll every other week, and then the funds would be deducted from the payroll account. There would be a negative balance until the end of business when the funds are transferred from operating to payroll in an automatic process. And then at the same time, funds would be processed from money market to operating to cover that transfer to payroll. So it sounds very complicated, but it's all happening kind of on the back end, and everything is looking at like our total account balance. So there's no overdraft, there's no there's no like timing issue, like everything happens on the back end. And it would allow for all of our excess funds to be invested, and Wintrust estimates that we'd see a net benefit of about $8,000 of increased interest plus the reduced, including the reduced monthly fees. What questions do you have or concerns about this approach?
How did you arrive at the $75,000 number?
That is the required minimum balance for the Elite checking account.
Oh, okay.
I guess just a comment. I mean, do we want to shop this around? I mean, are there other banks that might offer something better? Do we know?
That's a good question. I am open to shopping, and I think we could implement this first because we wouldn't have to change our account numbers to implement this change. So we could implement this change and start reaping immediate benefit, and we could shop if we so desired.
Rebecca, the interest we're getting on this is the one that matches with the Illinois funds, right?
Correct.
Mhm.
Yeah, I don't know that we'll find a better deal than this, because we shopped 2 years ago, I think, and that was by far the best. But it's always good to look around. My question is I guess it gets down to the timing when, like, after payroll is paid and there's that stretch where there's a negative balance. What if that's when a check gets submitted for payment, and pushes that even more negative or whatever? What happens in those situations?
The money is just automatically pulled from money market into operating to cover the check. This works a lot better if you just think about money as fake, and it's all just a bunch of spreadsheets. But yeah, everything, like, it is expected that you would log on to the account in the middle of the day and would see perhaps a negative balance. But any sort of, like, if we were to encounter an overdraft fee, for example, that would be like assessed at the end of the day. And so before that fee would be assessed, the funds would flow in from money market.
And Rebecca,
It's-
did
yeah.
Wintrust say something about covering that if for some reason we saw an overdraft
I
fee?
mean,
I was
yeah,
looking for my notes.
So yes, I mean, there shouldn't be an overdraft fee assessed to our account unless we did not have enough available funds in our money market. And again, like, all of our funds are essentially in our money market, so that should never be the case. But if there were some sort of technical error, Wintrust would support us. What is nice about this is there's not like a human on the other end, like, lining things up. It's just an automated process. So no one is like looking at our account and saying, like, oops, that's negative, I'm going to assign a fee. Everything is part of their, like, end of day processing, the system's end of day processing.
I think this all makes sense. A question that I wanted to ask Rebecca is kind of only obliquely related to this. There's a lot of us in Cook County that are chattering now about the late disbursements of tax revenue and all of that. Has CCS ever been impacted by, kind of in a tertiary way? A Cook County library doesn't receive their revenue on time. They can't pay their CCS bill on time. That leads to deficit spending on CCS's timeline. I mean, I haven't seen that, but I'm just curious if you all have had any concern from any members.
Nobody has expressed to us any concerns about making their quarterly payments.
Okay.
I've not seen it since I've been here. If we've had any late payments, it's been like board meeting timing, or like there was a weird thing where, like, a library miswrote a check and we were 42 cents off for 6 months, something ridiculous. But in general, we have never experienced issues.
Okay. I think this is interesting. I mean, I spend a lot of time doing transfers, so this is something interesting to analyze even locally at my library.
Yeah, and so again, this is like a multi-part recommendation, like moving to the elite checking, which based on our number of transactions would work for CCS, but may not work for a library. But my understanding is, like, the zero balance account services and the sweeps would be available with other account types as well. If there are additional questions about implications for CCS, the Wintrust team said that they'd be happy to meet with the Budget and Finance Committee or Executive Committee or whoever. If there are no questions, I think it makes sense for us to have a motion to implement the changes as recommended, so we have it documented that we discussed and are in agreement. And then we could take to executive committee for final approval.
So moved. Alex.
Thank you.
I'll second it, Mick. Has audio gone?
Yeah, I can't hear you, Beth. It's weird. Kind of cut out. Sort of. You're kind of there.
I muted. I thought I muted. I'll just stick with Anthony.
Yes.
Okay. Erica,
Yes.
Jim,
Yes.
Melissa, Mick,
Yes.
Ishwar,
Yes.
Tim, Alex.
Yes.
You are coming across very faint though, so you may want to just adjust your volume. Yeah.
I'll keep working on it. Thank you.
Okay. Thank you both for bringing that forward.
The one thing nice
Rebecca.
about Wintrust is they are this family of banks that are spread across the whole greater Chicago area, and I think they offer a lot of options for as we have more money to invest, you get more FDIC coverage. I mean, they treat them as separate accounts, so you really have the opportunity to spread your. So I think they're a very reputed organization, and they also have a small town community feel about them. So it's good to do business with them. So I think this is a good. This is a good decision we're making.
Okay, I agree. Rebecca, shall we move to the next item on the agenda? Do we want to talk about the budget now?
Sure, I love talking about the budget. I did include a draft budget in the folder. It is a draft. There are, as you can see, bright yellow areas where I haven't put things in. Looking at 25-26, I do anticipate that we'll be slightly underspent, but coming in pretty much on budget. Notably, we should be underspent in electronic resources, which we are kind of right sizing for next year. And that's just adjusting to the change in novelist coverage that we're subscribing to and figuring out that billing with EBSCO. It looks like an increase next year, but it's really the addition of Rolling Meadows and Wakanda, and then a small planned increase. We are a little bit over in professional development, which is also where we have meeting room rentals. Relatively minor there, and a little bit over in Datacom because of the delay in switching our internet service provider. I have not updated columns H and I, so don't attempt to pull meaningful information from there. But everything else for 25-26 looks like we're coming in right around budget. Are there questions about projections for the rest of this fiscal?
Why is the personal line lower than what you anticipated?
Molly didn't start. We had a new hire and Molly started in August instead of July. Is I think the primary difference. The other total difference is we've been continuing to budget FICA at a flat 7.65% of our salaries. But one of our employees has work authorization, but is not a citizen, so does not pay in all of those federal taxes. So that line, if you like do that math, the projected is a little bit less than 7.56 or 7.65%. Beth, did I say that right?
Mhm.
Thank you. So that is also a difference. If there's no other questions, I will move on to plans for 26, 27. My word, the time. So I have a list of potential projects here, two slides. This first one, potential projects, these would not have budget implications, but are either planned or we may not. We'll talk with long range planning. We may not do all three of these research projects in 1 year, but these projects do not have budget implications beyond costs that we're already planning for. Like we'll still have an Orange Boy subscription, right? But there's no increase associated. Potential projects that we have that would have budget implications are here, and I want to talk about these briefly. One project that is kind of been on our radar, but is maybe a little bit sooner than I'd like to do it overall, is a website redesign. So our website was redesigned and launched just about 5 years ago. And we're with a small company called Planetaria for hosting and website management. They also designed our website. And as we've been doing some accessibility remediation, we've run into issues where there are elements that we are not able to remediate in-house and that the vendor must do on our behalf. We're also on an outmoded version of the CMS and have asked them for a quote to do an upgrade. And between the CMS upgrade and the remediation that needs to happen for accessibility, we're looking at about $18,000 from them, which feels not super reasonable. And also like we could perhaps get a new website for a similar amount. We're also paying them about $5,000 a year between hosting and management and not getting a ton of services as part of that management contract. So the budget as it's written now includes some funds in development for a potential website redesign. So what's nice about that is that it's in development, so it wouldn't directly impact member fees unless we wanted to build in a planned transfer to development to cover any of that. We also have in our maintenance agreements line 4325, we've got some planned new Amazon Web Services spending. And this is right, we're doing the research right now, and we'll obviously have it finalized before the end of budget season. But we're looking at moving our last remaining server in the CCS office to the cloud. So that would be Web Reports and the listserv. That Web Report server is nearing end of life. And so we're looking at the cost of, the one-time cost of replacing the server versus the ongoing cost of moving to cloud storage. We looked at this a couple of years ago and felt like prices were not necessarily competitive, but we're looking again and things look more feasible this year. So this is currently written into the budget. The costs for the full year are in the budget, but that we likely wouldn't do this move until the second half of the year. Or at least the whole move. We've already implemented to kind of like test the waters, a cloud monitoring service using AWS to like acclimate to using AWS services. The next project on this list is a Sky River pilot. We talked super briefly about this. Oh, we have something in the chat. Oh, it's Beth. Hi, Tim.
It's me. Sorry.
We talked very briefly about this. I don't know that we actually said the word Sky River at governing board, but part of the rationale for continuing with Find More Illinois is, do we look at some libraries to drop their OCLC subscription and use alternate services for a period to see what that looks like? And so one alternate service could be Sky River, which is the Innovative Interfaces bibliographic utility. So a source of records and cataloging utility. Dean is telling me it's included in my subscription for Polaris. So we would be looking at like a $3,600 implementation fee, but the actual utility, he says, is included, which is not what he told us 2 years ago or 3 years ago when we looked at it, but it's written down. So I'm not going to argue and try to pay him more money. So given that it's included, I feel like that's a reasonable place to try and to do kind of like a real pilot with someone instead of some hypotheticals. Next year, we'd be finishing up the Wakanda and Rolling Meadows edition, and time will tell if we would have a new library edition to start in the second half of the fiscal as well. Does anyone have questions about those potential projects?
Just a question about Sky River. Do
Sure.
we know how it stacks up against OCLC in terms of, I guess, records or
So it does
holdings?
it does have fewer records overall. What we don't know, and that we'd be looking at with the pilot, is if that has an impact, right? Because OCLC serves a lot of different kinds of libraries all over the world. And so Sky River largely serves public libraries in the US. So does Sky River have all the content we need and OCLC has a bunch of extra content, or is there a significant amount of content missing from Sky River is the question we don't know the answer to.
Would Sky River be something that you would combine with researching centralized cataloging research?
Yes.
Okay.
Mm-hmm.
And can you speak a
Yeah.
little more? Can you speak a little more to what that research might, the centralized cataloging research? What are you envisioning there?
I don't know yet. So the research is really looking at, I think we'd start by doing kind of like an environmental scan of models across consortia across the country, right? Not just looking at like what our neighbors in Illinois are doing. As we were writing the strategic plan, the goal was to develop a service that would support libraries as they undergo attrition. So essentially an opt-in service for members. So there's a lot of questions about like what that workflow would look like. I imagine we'd have to be doing some like time studies to think about staffing, and like if our current staff could support that. And if not, our options for either some cost analysis of outsourcing versus internal hiring. So, the short answer is like, I don't know what the service will look like. And so the research is really looking at what exists out in the world and then a needs analysis for internally. Like, I don't know if our libraries have a sense of what their staffing will look like over the next, 3 to 5 years and then 5 to 7 and beyond. But that would certainly be some information we'd want to gather if it's available.
I just think we're going to learn a lot from both the pilot and the research. So, and that's going to be good for us going forward. So, I support it strongly. Yeah.
Yeah, we will certainly learn a lot.
Rebecca, do we know if anybody's using Sky River in a consortial setting? Because I know Gail Borden was using Sky River. I believe some other in Illinois. It seems like it's mostly larger standalone libraries, that have a little more autonomy in terms of not using a shared ILS. So do we know if anybody's been using Sky River in that
I do not.
capacity? Okay.
Yeah, that would certainly be something we need to figure out.
Got it. Thank you.
Mhm. If there's no other questions about this, there's a few areas of the budget draft I'd like to get some feedback on. My slide's wrong. So, your packet included this spreadsheet called rough billing estimates, and I put rough in all caps. So this is still the average adjusted income of our members that was used for this budget year. So this is not updated tax information. So these would not be the actual fees, but they'd be like roughly the same, assuming nobody experienced a huge jump in income. Also, RE Cook County, we have to figure out if that's going to affect anything. I don't think so, because I think we're like a year in arrears when we're looking at our data, but that will be a thing that we're working on when we're doing the actual billings. So this sheet has in here Wakanda and Rolling Meadows with their implementation billing. So again, kind of a review. This is kind of the first quarter. They're still on implementation fees because they're not live yet. And then quarters 2 through 4, they're on full billing for the year. So they're kind of broken out and their fees are determined first on this new library worksheet and then subtracted from our total billings. And then the regular billing is applied to all the rest of the libraries. So as you can see, we're increasing overall billings and we're expecting member fees to go up. The difference from FY 25-26 is in column I. The average is about $1,800. The max is about $2,000. This is just CCS member fees, not OCLC. For some additional context, last year in May, when we were working on projections, I was coming from like a worst possible scenario situation. And I said to governing board that I would imagine worst case scenario would be $3,000 to $4,500 average annual increases through 2031. So our current projections are below kind of that worst case scenario, which is good and what we were hoping for. Last year, we deliberately were operating with a little bit of a deficit just to kind of temper increases. And so the proposed total billings and fees here would completely eliminate the deficit. So we're caught up and income would match expenditures for next year. So given kind of that information, I mean, nobody likes any fee increase, right? But overall, I mean, this feel relatively palatable based on the context.
So pardon my ignorance here. Does this factor in any potential increases to our innovative subscription? I mean, that contract is coming up, isn't it soon?
Yes, so that contract should be, we're just about done with that. Our contract will have a 2% increase from last year to this year. And this includes that 2% increase as well as the additional licenses for Vernon. And then your one of the new libraries is covered by the new libraries. Okay. I am always at this meeting interested to hear what libraries are planning for their staff increases for their current fiscal, however that kind of lines up, or calendar year, however it lines up. We do our increases in July. The budget, as I have it written, includes 4% increases for staff. For 2026, Social Security COLA is 2.8. So 2.8 plus something to support rising costs. Is 4% in line with what you have done for your staff this calendar or are planning to do later?
Yeah, it seems in line. We did 4% last year. Our fiscal year is July 1, so we did 4% this year, and we're looking at around the same for starting July. So yeah.
Same for Prospect Heights.
We did 3.5 last year, and that's probably what we'll do again this year.
Wilmette was 3.5.
Crown Lake was 4%, but we'll see about this coming year. I don't think it will be quite that high.
Okay.
We're looking for an average of about 4% as well. Maybe a touch higher.
And
I will.
and we're looking at a range of 3.5 to 4.
Okay. So that feels reasonable, in line with what others are looking. I did also have a question about medical insurance coverage. So we looked at last year or the year before, we looked at our coverage rates based on, I guess the year before, based on the 2024 HR Source Survey of benefits for public libraries. That's on the slide. So we currently cover 90% of individual, 75% family, and then we offer HSA, and we offer $1,000 for individual and $2,000 for family. With the rising costs of medical insurance, have any of your libraries, or are you aware of any trends of like increasing what employers are covering for employees to help offset costs for employees?
At Round Lake, actually, our vice president, or the vice president of WIN, is one of our employees, and Mick, I know, as our neighbor, you're on there, and and talking to you guys, WIN is looking prospectively at a 15% increase in the coming year. And I don't recall what last year's increase was, but it was fairly significant. Our board, a couple of years ago, we did some investigation, looked around for various policies, even at a couple of other companies and other organizations or other consortium, because the rates were increasing pretty steadily. And we came to the conclusion that Blue Cross Blue Shield and WIN was pretty good for us. And one of the reasons that we felt like we could stay with them, compared to the extremely low cost of some of the cut rate insurance policies, is that we had increased the staff premium copay from, I think, 10% to 13%. And we did base that on a couple of variables. But 13%, whether it's, goes up to 14, 15, or 16, I can't say, but it's going to be tough for us to not pass along some of an increase to staff, because it's a fairly, pardon the pun, but healthy burden on us.
Mm-hmm.
We were able, because it was 18.5% this year. When we moved away from 100% employee payment but no family, to a mix. We grandfathered in folks who wanted to keep the single employee 100% coverage. This year we did away, starting January 1st, we did away with that. And that allowed us to increase our employer portion from 70% to 90%. So the employee pay, so we're 90-10 right now for Plan B. Plan A is still 60-40 because we want people to be on Plan B. And so that the savings from the 100% coverage for employee only, because we were all on a Plan A, allowed us to make that change without impacting our overall budget for the year. So, we're going to keep doing that. I hope it's not going to be another 15% increase next year. We'll take a look at things, but we had folks who were without any changes. Their insurance premiums were going to make their take-home pay less than it was before they got their raises in July. And so we didn't want anybody going backwards like that. So we were able to make that change.
Yeah, it was 18% or 18.5% for WIN, as Rebecca knows and Beth knows. I know Beth can't talk because her mic unless it's fixed. But yeah, Jim, 15% would be if we were lucky. I would guess closer to 18 to 20% again this year. And that's basically due to so many significant illnesses of great expense. And that's just the way it is. And so my library is not looking to back off. We do 100% for individual, 70% for family, because we are seeing this as potentially a storm, and that in a couple of years it might calm down again, and it just might be a couple bad years, right? I don't know what everybody else is. There are other library consortiums or other consortiums of health insurance that people might be a part of that not so significant. But for us, it has been significant. But we're hoping that after this year, we can hold on for one more year, and then the year after that, then we might have to reconsider the 100% and 70% and go down to 95, 65, something like that. But this is not. I don't know that this is the year, Rebecca, unless the budget is such that you can't afford it. And the good thing about us being July 1st and you being July 1st is that you're really talking about only 6 months. You already know what 6 months of your bills are. So you only have 6 more months of bills from January to July. Even if it's a 20% increase from what you already have, it's really only a 10% increase for the fiscal year we're discussing right now.
Yeah, I have budgeted in the budget. I have a 18% increase for insurance, and then no changes to what CCS covers. Does anyone cover more for family?
More than 75%? I think Algonquin covers 75%.
We do. We cover 80% in Plan B.
We cover 90% in Plan B.
Of family insurance as well?
Yeah.
Well, like we don't cover family at all. We just found that it was a rather high cost for us. And we had a number of employees who, when they looked at the straight line, just the straight comparison to WIN for family coverage, they were able to get it for a lot cheaper at a spouse's or partner's place of employment.
Yeah, full disclosure, I am on my partner's insurance. The difference in what we would pay for family insurance through CCS and through them is thousands of dollars a year. So I don't know how they pay for it. They're like 80 employees and they're self-pay for insurance. They're a self-funded insurance plan.
Yeah, and to echo that, Rebecca, when we were talking about, I was talking about the cost, it wasn't just the cost of the library. It was the cost, even if we applied a percentage rate that we applied to our other plans, the cost, the premium copay for staff was going to go up so significantly, that they couldn't afford it. So it wasn't even just a choice on our part, it really was an employee driven. So like you say, with the 80 employees that you have at your partners, place of employment. That's a tough question. I don't know how they afford it either, but
I
When I
know.
was
But
talking to
I'll keep letting
insurance,
them pay for it.
yeah, Rebecca, when I was talking to insurance, a bunch of different insurance companies just to try to understand what's going on. Libraries, people tend to stay till they're old, and there's
Fair.
risk that comes from that. And if you are insuring a fire department or a police department, yes, they have risky jobs, but they're generally not getting cancer because they retire at 55. And just the actuary numbers. And you've told me what your partner's job is, and I'm assuming they skews younger. If you're talking about Google Ads, I'm sure it's not quite the same thing as us. And so libraries are insurance brokers. Insurance companies don't really like libraries because our actuarial numbers are we skew high. We skew staying long.
And one,
That-
our health consortium has told us that one of the big factors contributing to those high increases is the increased number of people who are going on these weight loss drugs. What do you call them? The GLP-1s and the Wegovys and that's really, really astronomically driven up costs for the insurers. So, I mean, that's the reality we have right now.
Okay. I think what we're offering now is in line with what our members offer. It is built into our budget this year. So we will continue to offer it.
Rebecca, quick question about the HSA. We don't offer an HSA. And I know that's something that CCS uses almost entirely and so this is almost, but like, is the HSA competitive with the other levels, the B and A?
So yeah, we offer all three plans. We offer plan A, plan B, and the plan C, the high deductible plan with the HSA. And the plan C with our HSA contribution puts us at like the cost for plan B.
Okay. I just wanted to make sure I understood that.
Is that right, Beth? Yeah. Yeah, and so we have 2 staff members on it. Again, full disclosure, we're on the high deductible and HSA plan at my partner's insurance. I think it's a really nice option. I know that not a lot of I think we have the only 2 people in all of WIN that are on the plan C. I like it. I mean, personally, I like I think it's nice to have the option. So
it's not the plan losing us money. So it's from the WIN perspective, it's not a problem.
Right.
But as long as from a CCS, it's a budgetarily appropriate level. It's not like you're pushing people to it by expanding how much money you're giving them and stuff like that.
No, it's for us, like obviously plan A is the most expensive. But I mean, given the number of staff that we have, I mean, like insurance is expensive, but I don't want to take it. Like, I don't want to, I feel, if I were going to get rid of a plan, it would be plan A, but that feels harsh. It feels like it would be a big change for people.
A quick question. Do you cover the same percentage for plan A and plan B? So
Yes.
the way we do it, because plan B is a lot less money, is that we cover 100% of plan B for an individual, and then whatever's left over, then the employee covers for plan A. Because we want to incentivize them to use plan B because it's a much less expensive option for the library. And so now that I'm hearing 90 and 75 for plan A and plan B, I assume every single staff member would choose plan A then. Like, why would they choose plan B when plan A is such a more significantly stronger plan?
We do have we've had some people switch back and forth. We had plan B last year.
Yeah, we did not currently have anybody on plan B.
Yeah.
Yeah, we do a little bit differently. I'm sorry if I'm interrupting. I think my mic is going out too. Anyhow, we do similar to Lake Villas in the sense that we pay all of plan B But on Plan A, that's where the employees pay their premium copay. But on Plan B, we found that the cost was so significant. If we covered 100%, it was a pretty good savings for us too.
Okay, maybe we'll look at that math for our next meeting, is look at increasing coverage of Plan B.
From an insurance perspective, we not from an employer, but from an insurance perspective, we want to kind of guide people to Plan B because it is less expensive to win, ultimately. But from an employer, if you can afford, I would much prefer to be Plan A, but we choose Plan B because we don't want to spend the extra money.
Yeah, we'll do some like playing around with the numbers, like within kind of what we have budgeted. Yeah, I mean, like, I don't know. Insurance, man. Healthcare. It's a drag. Sorry.
That's okay. That's okay. I guess I'd be curious to know for the libraries that pay the Plan B, if you have an idea of the demographics, is it single only? Like, where is the staff at in their lives, maybe? Or are they really just individual because their partners or spouse or children are on another plan? Right? Like, I feel like that's because we're so small, like that. I'm just wondering how much of an impact that would have.
I think I got your question, Beth. I'm not sure I got it all, but pretty much every single staff member for us are on Plan B. We have one staff member on Plan A, and it's because we do pay 100% of Plan B. So people are like, what? They do the risk analysis and say like it's better to save money on Plan B. The person who's on Plan A made that choice with knowledge, and so they did the risk analysis, said this will actually save me money to spend extra money to be on Plan A. So we incentivize Plan B to a degree, if you understand. But we also offer opportunity every January 1st to move to Plan A at the the cost. And so I don't know if that's answering your question entirely. Maybe if you type it in chat, because
we can always talk about Plan. I mean, I think it doesn't even really necessarily matter if someone's on Plan B because they're not trying. They don't have dependents or spouse to also be on insurance, or if they're on their spouse's insurance. I do know that Rebecca and I talked about, and even spoke with MMA about doing a plan review for our staff in the spring to get a better understanding of the differences between A, B, and C. So that might be an opportunity, especially if we're trying to possibly change the percentage of coverage on B, that may help folks get a better understanding of the differences of and which one turns B. So
right. And it could be that we decided to add an HMO. That's not just determined yet, but if we do, then it might be that CCS wants to incentivize HMO even higher because that'd be less expensive to CCS ultimately and the insurance group. I'm not saying that that's what's going to happen. So anybody in Win, don't take that home and think like they're going to do an HMO. This is just my idea right now. Beth, we can talk tomorrow at the Win meeting.
Those were kind of the areas of kind of budget planning that I was specifically looking for feedback. But I'm happy to take questions or feedback on any other parts of the budget. Again, I've still got some things I need to refine, and obviously the spreadsheet needs plenty of cleanup.
Can we take a look at the development fund budget?
Sure. Yeah.
Oh, sorry, Mick. I didn't mean to cut you off.
No, go ahead, Ishwar. That's more fun anyway.
So in the development fund, so I estimated interest staying the same next year as is projected this year, thinking even if there's a decrease in interest rates, if we're shifting more to be invested, maybe it would stay about flat. The rail support grant, I'm gonna double check that number. doesn't super look right to me. But so we have special, thanks. So special contractual, this is where, like if we did a website redesign, those funds would come from. And then special softwares on the next tab. And then we do have, this is our last year of like OCLC kind of easement where we'll underbill the libraries that had an OCLC increase due to our fee structure change. So this is the last year of that. It's a very small amount. Here in special software, we've got Orange Boy, the new pricing for Find More Illinois. It is very handy that Rails is on the same fiscal as us. And then our discovery interface, you can see there's a cost difference between last year's budget and this year's budget. This is the planned actual cost based on our agreement. However, this there's two features this does not include, and that is deliberate. We're continuing. So far, it doesn't seem like they'll benefit us. Oh, thanks, Beth. The Rails grant number is correct. Okay. But there's a potential that this number will go up a little bit. Based on if we want to implement some additional features. Was there a specific question you had? I should have asked that before I just told you all the things. No? Okay. So as expected, we would be expending more from development than we plan to bring in, but that is something that we have kind of planned over the next several years while we're working to operationalize new services. Other questions or areas to review?
Okay, hearing no additional questions or discussion there. Rebecca, what are our next steps with the budget then?
So I have to clearly tighten some things up here. And we would be looking for, since there's nothing like shocking or alarming here, I think we need one more meeting. The budget will be sent to governing board at our May meeting. So we would want to meet in April to review the final version of the budget and recommend to the board. So I think it's probably easiest to do the meeting coordination via like a doodle poll or something. Does anyone have like significant plan time off in April that we should consider at this time?
Oh, just the first week when we'll be at PLA.
Yeah.
I guess the only other question is, what is out there that may be totally unexpected? I mean, I guess what keeps you up at night? I mean, given the projections you made, what could significantly alter some of those projections?
I mean, I guess if there's, I don't know, some sort of like shocking vendor shakeup, a la Baker and Taylor, but I feel like Innovative and the Clarivate umbrella is stable. So that would be kind of the biggest concern, right? If BiblioCommons or Innovative collapsed, but I think they're both in a very healthy place. If if a library funding is really the only issue. If to was it Anthony earlier? If all of the libraries in a county couldn't pay their fees, what would that look like? We do have reserves. So we have operating reserves as well as the development fund. So if we had to float, some number of libraries for some months, like we should be able to do that. I don't want to. I want libraries to be funded, but I think that would be it. Overall, our funding patterns are stable as long as the libraries are stable. And if we can reduce that OCLC burden over the next few years, like that, I mean, OCLC's it. Like it's $500,000 a year. With that we just don't have any control over. Whereas other things, it's like, well, we can, shave here or trim there. So long-term OCLC, short-term local library funding issues.
So we started the meeting with Evanston, and I want to ask one Evanston-related question, given all the uncertainty and in the unlikely event that they decide to pull out, with the new leadership coming on board, and what kind of an impact might that have on us, if any?
Yeah, we did some of that math last year, and I mean, it would certainly have an impact. But I think Mick summed up my very complicated math really nicely, is that when a library comes in, members see a small decrease in fees. So if a library went out, they'd see kind of an analogous increase in fees. So it wouldn't be earth-shattering to any library, but it would be noticeable. I mean, outside of losing access to their resources. Per our policies, any library that leaves, like, they're responsible for paying any cost of like exit services from a vendor. Based on previous experience, it shouldn't be too much CCS staff time. It would really be more on the library side that they would be experiencing that disruption.
Okay, great. Thank you, Rebecca. Nice job with the budget.
Thank you.
I agree. I think it's looking really good. Is there anything else that we need to discuss? We'll do the doodle poll, and we'll find a date in April to schedule our next meeting, and then we'll advance our recommendation to governing board after that meeting. Okay. If nothing else, then I will move to adjourn this meeting at 11:03.
Second.